The skin scrapings procedure is a clinical diagnostic tool undertaken to identify evidence of Sarcoptes scabiei, the microscopic mite that causes scabies. A skin scraping of mites is required in the Northern Territory under the Notifiable Diseases Act for the correct diagnosis of crusted or Norwegian scabies. This video will outline the specifics of performing a skin scraping procedure, including the equipment required, gathering images of the site, conducting the skin scraping, and preparing the pathology. Equipment required for the skin scraping procedure includes sharps container, gloves and alcohol-based hand sanitizer, disposable bluey, apron if skin precautions are required, relevant pathology paperwork, yellow top specimen container, and a clinical scalpel blade. In the Northern Territory or other geographically remote areas, a camera is also a beneficial tool. Providing clinical photos of the infested area to your nearest infectious diseases team or dermatologist will assist in both confirming the diagnosis and determining a correct treatment schedule. Handling of images, including storage and sharing, must consider privacy law and strictly follow your organisational policy. After the suspected area of mites has been identified and you have taken a clinical photo, it is time to perform the skin scraping procedure. Gently use the sharp side of a sterile scalpel held at a 90-degree angle to scrape flakes of skin into the sterile specimen container. Do not cut or injure the skin. Ideally, scraping should be taken from where scaly skin occurs. A few pieces of skin may be sufficient. However, try to collect as much skin as possible. Don't rush the process. The more skin collected, the greater the chance of collecting mites and confirming their diagnosis. To meet the case definition of crusted scabies in the Northern Territory, a skin scraping must return a positive detection of scabies mites. All positive skin scrapings will be reported by the lab to the NT Centre for Disease Control. Ensure the pathology slip requests testing for scabies mites. This is vital, as the lab may only look for fungal elements if not requested. Make note of the area of the body the scrapings were taken from, and complete pathology paperwork as per legal requirements. Send your collected sample to the lab for testing, and dispose of sharps and waste as per clinical guidelines. For more information on the management of crusted scabies, go to www.onedisease.org.